Vircho presents the Social Impact Series with Leah Peters.
Welcome back to Virtual Social Impact Series. We've been inside the lab with CTO Greg Fitzgerald, on the roadmap with Chief Product Officer John Jones. Now we have the pleasure of hearing from the helm with Virtual CEO Craig Manson. Craig, thank you so much for being here.
Leah, it's my pleasure, and apologies that my voice is a little lower than normal as I've a little bit of laryngitis, but I'm going to power through and hopefully you can appreciate the more bass tones.
The people might not have known. I know. Well, Craig, I'm really going to start with you and your experience as a leader. What experience has most shaped how you lead today?
So I guess for me, it kind of comes down to I suppose for everybody, it's how did your career pan out? So I'm now I'll be more glass half full midway through my career, not at the beginning at least. And when I look back at the years that I've spent working, there's kind of two categories of work that I've done, where that's work in a company or voluntary work that I've chosen to do in my spare time. And the first category is data. And I've had data involved in my work throughout the course of my career. But sometimes it's been more prominent than others. And as an example, when I was in the British government, where I spent several years as a consultant as head of innovation, I got access to some of the most extraordinary data sets that exist in healthcare. There really aren't many health economies where you've got cradle to grave data for almost every single citizen in that country. And then being able to look at that and think, how could we use that to improve the lives of patients, to drive their decision making both in the system and for the patient themselves. That was an awesome opportunity. So there's been many roles that I've had that have had aspects of data. So I became a great appreciator for the power of that data. And then on the other hand, a lot of my time, particularly on the voluntary side, has been thinking about people and the psychology of people and indeed mental health more generally. Back in 2010, I co-founded an organization, charity in this case in the UK, which was focused on working with marginalized, gang-involved young people that really social care services had found impossible to reach. It was really just law enforcement that was reaching them. And could we use music as a novel way of engaging with those young people and bringing them in to the care system in a more functional way? And it really helped me understand just the reality of life for many people, not just in the UK, but there are great similarities in those experiences here in the US as well. So that was really about learning how to engage with people and empathy. And I suppose to bring it together, what's shaped me is the combination of those two. Data alone is nothing if it doesn't work in the context of the individual. To put it another way, empathy without data is unscalable. It creates burnout, and data without empathy is just cold. So to think about how that affects or influences my world now, and when we sit here in Virtual, and you know this because we have these conversations a lot, we've got amazing technology that we create, but if it isn't serving a human well, then what's the point? So for me, it's that combination has really helped me and drives a lot of the way that I lead and the way that I think.
Yeah, I think we could talk all day about the variety of experiences that you've had. I'm always pretty fascinated by just drop in something here or there, but we'll continue for the sake of the
Oh, I
people.
didn't tell you about the time that I rented the world's second largest radio telescope in the Ukraine in order to send. You don't know that story. There are a whole aspect of my career that maybe we'll have off hours version of from the helm, Leah. But I'll keep
Well,
us on our track today.
we'll have to talk about that. Seriously. So, what's one belief about leadership that you've changed your mind about over time? I mean, you've had these vast experiences, and some of them are so different from others. I'm sure that you started out kind of believing one thing and may have changed that over time. Is there anything that comes to mind there?
I think as a young leader, I was very focused on projecting at least certainty. And I think I was perhaps too focused on, or felt it was my role to always project certainty, to almost act as an umbrella to absorb volatility, shield team from information that perhaps I was afraid would affect them, affect the way that they were approaching their role creating anxiety. I think that was probably not uncommon for younger leaders. And I think as I got older, I started to realize that the protection was really counterproductive. If anything, it actually bred fragility. And what really matters in teams is building trust. And trust comes in many ways through transparency. So I think for me, I learned that transparency is in many ways the ultimate form of respect. When you trust your team with the realities of a situation, you aren't actually scaring them. You're giving the context that they need to do their best work. And in return, in my experience at least, they give you their trust. So for me, that I think was a really important lesson and a shift in my thinking.
Yeah, I think similarly, I've always thought you couldn't fully be yourself as a leader because in my real life, very open, honest, but as a leader, you have to sort of be buttoned up. And I was like, maybe not, right? Because then when you're buttoned up, you sort of become this false version of yourself that people recognize immediately is not genuine. And one of the things that I've always respected about you is the genuine nature of yourself as a human being and as a leader. So definitely appreciate that part. But I want to talk about
Can I add one thing? Because you just
sure.
like teed it up there. That I don't think it's just unique to work, but it's just something that happens as you get older, or maybe not to everybody, but it has to me that you learn that vulnerability becomes a strength.
Yeah.
It's like a process that you go through to realize that being vulnerable, whether that means in your personal relationships or your professional relationships, isn't something to be feared. In many ways, it is actually a genuine strength, and others appreciate you for it. So I was brought up in a particular culture in Glasgow, in Scotland, which I think is often described as stoic. You show no emotion. You just get on with your work. You don't create a fuss. And coming from that to now appreciating that in fact, while there were many great aspects of that, and I'm very proud to be where I'm from, being able to get through that vulnerability door is so important, and just developing yourself as a person, developing the relationships and deepening the relationships that you're able to create, whether that's with your colleagues or your partners in business or partners in life.
Yeah, I think it's noticed and it's appreciated. I want to shift now to sort of the real world of your life as a leader, of Virtual's world, of the care space that we're in. This landscape shifts so often. One of the things that shifts most often is the funding. So how do you lead through that? How do you lead through those changes?
Well, you're absolutely right. There's a there's a lot of shifts in funding right now. I think you've got to anchor really rigidly to your mission, but you got to become really flexible with your tactics. So when you see a shift as significant as we saw with the one big beautiful bill, you can have the best 3-year strategic plan in the world, but if you cling to that, you're going to drive up. So it's really important to question some of those fundamental assumptions in the context of that substantive in the reality. So I think in a practical sense, you inevitably have to move away, at least temporarily, from thinking about things in longer annual strategy cycles and shorten that down to quarterly or even monthly. I think you've got to really emphasize the importance of being clear to your team about achievable short-term goals so they don't get paralyzed by what can feel like really deep long-term uncertainty. And then you've got to just think about the reality for your clients and kind of obsess about it. The funding shift affects people. It affects people our clients serve. And our job is to ask, how is that hurting those partners? What pain is that causing, and how can we use our technology to relieve it? Become, to the extent that we can, a stabilizing force. When funding gets complicated or scarce, technology must step in to streamline a lot of the reporting to help prove the ROI, reduce the administrative burden. So I think that's really important. And the last thing I guess is a somewhat consistent with what we talked about earlier, is just being ruthlessly transparent in your communication. You're operating in turbulent times. All you can do is to say what you know, be honest with what you don't know yet, and explain exactly what you're doing today.
I love that. And I love the focusing on the mission, but being very flexible in the tactics. I truly appreciate that. And we've spoken about funding as a fundamental challenge. Do you think that's the defining challenge facing social care networks right now? Or is there something else that you would say is their defining challenge?
Well, kind of yes and no. I don't think that the defining challenge is a lack of money. I think it's the flavor of the money. And I'll tell you why. It at the moment, at least as I see the world in social care, we're kind of trapped in this pilot project paradigm, and we got to stop treating social care like a time limited experiment
Yeah.
funded by a waiver program here or rural health over there, and start treating it as a core reimbursable infrastructure of a modern healthcare system. And I think
I feel like
honestly,
that should be on a billboard. Core reinforceable.
I'm happy to license it to you if you want to use it. The, there's a sort of waiver trap, and you got this reality where a lot of social care networks are spending half the time building a program to conform to whatever waiver funding source they have, and the other half of the time simultaneously panicking about how they keep the lights on when the waiver expires. And you can't live like that, at least not happily or successfully. And you certainly can't build systemic generational health equity on a 3-year ticking clock. So that's a problem. And it creates this innovation exhaustion. And that we can do better than that. And I think the other theme is shifting us from social good, which is super important, but into medical necessity. And it's a mindset shift. We need to move the programs that we support, whether that be food insecurity or housing or transportation, out of this category of community goodwill and into the core operational budget of health plans and providers. And it, I I believe, I know you believe, I know many people in our community believe that writing a script for healthy food or stable housing needs to be viewed and indeed funded with the same permanence as writing a script for insulin. It's the only way we're going to see these programs succeed as part of an integrated social care and healthcare system. Then
You're
I guess,
definitely preaching to the choir.
well, I'm both relieved and not surprised by that in the context of you as my interviewer. But I think there are we need to hold our feet to the fire on these and not just sort of see them as long term ambitions. They have to become short term realities. This is a critical transition phase for the sector that we're in, and we need to make some difficult choices in order to achieve that. And we all need to challenge ourselves to think, how are we going to play a role in helping shift the social care system into a permanent part of an integrated healthcare ecosystem?
Yeah, and we all play a part in that. Is this a place that you see social care leaders getting stuck? Or do you see some other quagmire for them where they're getting stuck?
I think there's a lot of overlap in that for sure. I think if I look at leaders in social care networks, first of all, I have great sympathy for them because right now it's hard. When we talk there about that innovation exhaustion and those challenges of waiver fatigue, they're real. I have great sympathy for that reality. But they're kind of getting stuck trying to cross a really substantial chasm. You've got on the one side the traditional community social care work, and the other side of that being this enterprise healthcare, and they're trying to build a bridge, but they're trying to build that bridge using spreadsheets, manual data entry, outdated CRMs, and almost invariably they've got the right vision, but they're stuck with the wrong operational tools, and that's very difficult. And then if we break that down a little bit more, you've got a mindset shift. I think a lot of leaders are still operating under the old rules of the game, still thinking like a traditional nonprofit, focusing on storytelling and grant writing, not thinking of it like a modern healthcare operator. I mean, to be blunt about it, and I don't mean this in a disrespectful way at all, but in a post One Big Beautiful Bill world, having a heartwarming story about a family needing housing just isn't enough. You've got to be able to show how that work is creating a meaningful return on investment. In another way, you've got to be able to translate from mission to metrics, and that is a big shift. And I think there is a real bottleneck around ROI. Social leaders know they need to prove it, but they hit a wall when it comes to execution. And we've got to try and help leaders through that wall. And that's certainly a lot of the work that we do at Virtual. I know a number of our colleagues in the ecosystem do it as well. That's critically important. And then lastly, uh, there's just a real challenge around squashing humans to a point where they can no longer functionally contribute. And that just becomes a reality when you reduce funding. You inevitably have to ask community health workers to do more or to do things that they weren't trained to do, like become data analysts or essentially operate as compliance officers. So a lot of those, I think, core themes that we talked about earlier apply to this question. And so I have a lot of sympathy for leaders that are sitting in these roles today. And there really has never been a more important time for those leaders to start to think about the role that they can play in helping that chasmic shift and doing their best to accelerate that transition.
If I'm hearing you correctly, it sounds like you're saying in this space, responsible leadership looks like creating sustainability in an environment that can shift and change quickly. It can shift and change drastically. Um, and my question for you is that what responsible leadership looks like to you? And are there other aspects of what it looks like that you would sort of put out there for folks to know or to understand?
So I guess let me kind of, if it's all right, reframe your question a little bit.
Sure.
It, I the way I sort of look at that is what do social care networks and their leaders need to get right in the next 3 to 5 years to continue to serve their vulnerable communities? And I think again there are just consistent themes we're going to see through a lot of these questions. And in this case, it's that transition from being viewed as a community alternative to becoming part of an integrated supply chain for whole person health. If we don't standardize, we don't scale. And if we don't scale, then we let down the very people that need our services most. So what does that mean in reality? What do we need to be getting right more specifically? We talk about interoperability a lot in healthcare land. And as you know, Leah, I spent much of my last 15 years in traditional healthcare. I know that you obviously have as a clinician on the front line over at Texas Children. So we hear that word interoperability a lot in our old lives, but it's also now super important in this world in which we operate around social care. We can no longer operate in a data vacuum. Got to be able to communicate the data that we generate to the extent that we can seamlessly back and forth with the major EHRs. And our industry must, whether we like it or not, become fluent in Z coding and billing. It's not that we're expecting our clients to do it themselves. It's our job as vendors to try and reduce that friction and to the greatest extent that we can hide all that work behind the scenes. But as an industry, we have to embrace that. And then and this is probably a more sort of general theme across a lot of industries, but we need to move from reactive to predictive. Social care right now is almost exclusively reactive.
Yeah.
We catch people as they fall into crisis and we try and get them out of it. But as we look forward in the next 5 years, we need to use the data that we generate to get ahead of that curve. It's more efficient to do it that way. When people are in crisis, they're actually much more expensive to bring back. We're
Right.
much
Mhm.
better off investing and avoiding getting them into crisis in the first place. So if we can use things like predictive analytics to identify, for example, housing instability before an eviction happens, the clinical outcomes and the financial return on investment, it presents a much more rosy picture. And then I think lastly, doing what we can, particularly as a vendor, to scale empathy through automation. Networks need to get that operational efficiency right. There isn't the funding anymore to support more people. The administrative load is not compatible with scarcity in funding. That means automating the heavy lifting of things like compliance and reporting and intake to allow the human workforce to spend as much as it can, if not 100% of its time, on the human connections, which is really where that human workforce is going to do its best work. You can't scale the empathy, but you can scale the efficiency that makes that empathy possible.
Yeah. I think it's hilarious. I think my next question you've answered in the last 2 minutes. It's like we are a technology company, right? So we think a lot about technology and the role technology should play in this. space, but you've spoken about that a lot. And then you really just answered the question of what role technology shouldn't play because we are not the human beings, right? There is a human level of empathy that is required. Let me refer, we are human beings, clearly, but what we are providing to people.
Or maybe you're an AI alien.
I
You're
mean, with your
finally
deeper voice,
revealing the truth.
your
I did
deeper
wonder
voice
why I've
is a
never
little
met
bit
you in
more AI.
person.
The deep Craig is more AI than the normal. But so we're not the community health worker that's going into people's homes, right? And that we will never be here to replace that. We are simply here to scale that person's ability to impact more people and to prove the ROI of that person on the community that they serve. So I kind of answered your question for you, sorry. But do you have any other thoughts on the role technology does and does not play in this whole ecosystem?
I don't think there should be any technology in the social ecosystem. Oh, sorry, that's our interview. Well, let's let's just build backwards then from where you went, which is what it shouldn't do. And I think you pretty much nailed it. Well, first of all, it can't build trust. So it shouldn't be involved in any aspect of that part of the work that we do. No one's opening up about domestic violence to a dashboard. There are things that humans do well, and it'll be a long time until that changes, if ever. And the second is the technology shouldn't be the focal point. The worst thing you can do is put another screen in front of a care worker or a client in a crisis. If they spend more time looking at, in our case, Vircho than the client, we have fundamentally failed. Shouldn't be the focal point, cannot build trust. What should it do? Standardize and translate between what the community-based organization is doing and the hospital system that's part of this integrated world. And what does that mean in practice? That means the interoperability we talked about earlier, the Z codes, ROI tracking, doing that all automatically, removing friction. So to the extent that we can, that administrative bloat being crushed, making intake faster, reporting effortless, compliance invisible, all of that is critically important. And then enabling prediction. We talked a little bit earlier there about how being able to predict some of these crises earlier enables us to be more efficient in the way we deliver service. So I think these are things that like technology should do. But from our standpoint, what's our philosophy? Be invisible. Be the enterprise grade plumbing that is so seamless and reliable that the social care worker never even knew it was there or didn't have to think about it. And handle the complexity of healthcare integration because it is complex, it is painful in the background, allowing the space for that human empathy to be in the foreground.
I love that. It will surprise no one since we work at the same company that we have many of the same values. um, if you could give one final piece of advice to executive directors who are navigating uncertainty, what would it be?
Protect your people. As the funding becomes more challenging, or at least the funding models become more challenging, don't try and absorb the system complexity with the result of creating human exhaustion. You've got a sacred mission, but your operations aren't going to run on willpower. So a lot of, I think, I've certainly seen this, that when you look at the reality of social care networks and how they operate, when the funding gets uncertain or the reporting requirements become more complex, the first instinct is just to get the existing team to work longer hours or do more, do things they wouldn't otherwise have done or haven't been trained for. In a post one big beautiful bill world, you can't outwork the lack of interoperability. That isn't going to work that way. 80 hours a week isn't going to magically translate to a spreadsheet that you can provide to a payer. So avoid trying to just head in the sand, hope your people will solve it or bring more people in. That's just not going to happen. I think demand radical operational honesty. Look and see what is burning your teams out. Obviously, state clearly that it isn't the difficulty of the clients, it's the friction of the system, duplicate data entry, reporting requirements, fears of funding. And obviously, we have a bias as to the role that technology can play in ameliorating a lot of that. Partner with people like us who understand technology, who care deeply about the mission that you're pursuing, that want to be able to take off your table a lot of those burdensome non-core activities to allow you as a social care network to do more of what you do better for longer in a sustainable way.
That was perfect. I really appreciate your insight today, Craig. This has been actually pretty fun. I mean,
I'll
clearly
try my best.
so I really appreciate you being here today. I appreciate your time. And we will see more of Craig on his continued From the Helm section of the Social Impact series. So thanks. Have a great day, Craig.
I appreciate it, Leah. Thank you.